Great. Okay. Temporal points, lateral hump. Let's talk about how to do this. The key thing I want to stress again, this is advanced. I want to say it again, this is advanced. You should not be doing temporal points, temples, in your first few years of practice. I think whatever you like. What are the pros and cons? Pros is that it really creates a balanced result. If you have this beautiful frontal hairline and you don't have the temporal support, it doesn't look as good. It can even look it can look unnatural if it's not balanced. We'll talk about what that means. Youthful, when you have a good temporal frame, it just looks better. It looks more youthful. And does it age better? Maybe. In certain respects, that if you transplant here and you don't do the temples, once those temples start to recede back, you start to have an unnatural, potentially somewhat unnatural result for the frontal hairline. So that could be, it could age better if you do a temporal point. Cons, it's very difficult to do well, both for you as a physician to make sure your angles are super flat, right, correctly directed. Very difficult to do that well. And often, as you heard from Paul McAndrews yesterday, is that you need a lot of hair. Sometimes you make this very aggressive frontal hairline and they lose all this temple, and then you need so much you don't have enough to replace it over time. So you need a lot of hairs for the temples, and that's something that you potentially have to calculate in advance, because some of those hairs that would be put here need to be distributed there, and you may have less density here, and also you may run out over time. So that's another con. And the other thing, maybe it doesn't age better. Maybe it actually ages worse. Maybe when you put so much up here, you're going to run out of hair, and then you got all this stuff behind it that doesn't match because you put so much on this aggressive temporal point. So I know these are a bit abstract, but this is part of the judgment that goes into what you're going to learn from hair restoration. And tomorrow, with that critical thinking, my goal is to develop your critical thinking skills and not to be mechanics just walking in like a cookbook, but really thinking more intelligently. So how do you think intelligently? Well, first you got to understand what naturally exists in the world. How do you create a natural hairline? How do you create a pattern that looks good? Well, you must memorize. You must understand the Norwood classification, because this is the pattern that men lose hair for almost all the cases. And so go around looking at bald patterns, and this is what I challenge you during the workshop, is I wanted to see you do a hairline and see, is that even natural? And so does that pattern make sense? So when you look at the one on the left, it's more of a conservative hairline, and then when it's really aggressively put forward, if you don't have that lighter shade of the temples, it doesn't look right. It looks like a hairpiece. It looks off. And the reason it looks like a hairpiece is a lot of hairpieces have a great, woven, beautiful result here, but it's hard to make those temples look natural. So they have this receded temple and an aggressive positioned hairpiece, and that may not look so good. For example, if you can't see that this looks somewhat off, then you need to really start looking at the fact that this temple doesn't match this hairline. And if you don't see it, don't worry. It took me years to start seeing things that didn't look quite right. And now I can spot it from 20 feet away. You probably can't spot most of the things that are unnatural. Start to develop that eye. So how do you where do you put that temporal point? The temporal point is just the accentuated edge of a temple. And we're going to start breaking down temples and temporal points in a moment. But you heard before, is basically from the tip of the nose going through the mid-pupil, and then one from the tricchiana, where the ideal hairline is front, going to the lobule, and then you make that intersection. This is from the book, by the way. So again, the other thing is, think of, when you're ever confused, go back to this basic model of the head like a box. When you see the head like a box, you start to see where it is the lateral hump, where it is a temple, and that makes things, I think, a little bit easier to follow. And this is just a more of a schematic, breaking it down with a real head to show you where the lateral hump is. You can see that on the image on the right. And then you can see that the temporal point is, and the temporal hairline is the area, just the front side of that lateral hump. And the lateral hump being everything on that vertical plane on the side of the head. And we talked about angle, direction, and tilt. Don't worry about tilt. But the angle, again, is going this direction, anterior, posterior, and the direction is going this direction, okay? So here is just a schematic of showing you how, if you look at B, is probably the most important one, or maybe even C, you can see how the hairs go down and back. I'm going to give you a better schematic in a moment, but just to overview where all the angles and directions on the scalp are, and then we'll specifically focus in on the temple in a moment. So we're going to talk about three clinical scenarios when we talk about the temple. One is just a little bit of upper temple loss. 2 is going to be a full temple, and then 3 is going to actually be this accentuated point called the temporal point. So let's first talk about the upper temple. This is just that upper portion that you just have a little recession and is not rebuilding the whole thing. And when you have that little bit of recession, then your angles, remember, once you go from the lateral hairline over, it starts to curve and it curves down. The key with this, which you're going to see me do a demo, it's got to be super flat. Those angles have to hug the skin. I mean, literally, you can't go too flat. And those 30-degree angles we talked about for the front are too high. We're talking about 0 to 10, and 10 is even almost too high, because whatever you go low, it's always going to potentially ride up a little bit. And you don't want these, I know my temple hairs stick out, but don't use me as a model. I've got weird hair. But if you look at most hairs, they go very flat. And once you start getting your temples sticking out, that's why you should not be doing this for the first 5 years of your practice in hair. Because you're going to make these people look like, I hate to use that word, a cripple. Because that's what we do, is we hurt people when we don't know better. And sometimes it's not because of ethics, it's just because of their lack of knowledge what we can and cannot do. So I'm telling you, do not start doing this. And if you look at the temple is the area without that point, and you can sort of see it sweep down and sometimes a little back. And you say, well, how do I know back? What angle? Please go look at people without balding temples and look at them. Look at certain balding temples. Look at and look and look and look and digest. The more you look in nature, what's real in nature, the more your brain will start to see things. Malcolm Gladwell, in his book The Outliers, talked about the 10,000 hours. It takes 10,000 hours to become a chess master if you ever get to that level. But you need those 10,000 hours in hair to really begin to see differently. When your brain starts to adapt and you can almost see something doesn't look right. The temporal point is very similar to the temple, but at the temporal point itself, the angulation goes almost straight back. So that way the hairs don't, on the temporal point, don't grow down into the face. They go back. So they sort of sweep down, go really acutely backwards on the temporal point, and then down. Once again, I emphasize this is an advanced topic that maybe if you're not ready for this, at least you're enlightened to understand it, and maybe you can go into this down the road. The lateral hump is going to be the area that we talk about, or parietal hump is another word you've heard, is the area on the sides. Why is it called a hump? Because when people start to lose hair, you get into the Norwood 6 and 7 patterns. The 6, you have this rounded pattern like this, and then that starts to recede and recede and recede. And when you get into a 6-7, you have to start rebuilding that hump, because otherwise you're going to have just the frontal hairline extended too far laterally. You've got to build this up to the lateral canthus, and then everything medial to the lateral canthus, remember, is mid-scalp or hairline. So that lateral hump, the design is different, is basically, it's like a waterfall. It goes straight horizontal for the first row, and then it dives. And each successive row, it dives more and more until it goes almost vertically going downwards. So just keep that in mind. It's this cascading effect going down. I think this is from Ron Shapiro. So it's a great drawing. I use it for everything. It's going down like this. And then you can see that front temple is the continuation of that lateral hump or parietal hump, which goes down and then almost arcs back a little bit. Can you see that? It sort of swirls down a little bit as you follow that trajectory going downwards. Like this point? I don't know. Where's the pointer? All right, don't worry about it. Oh, here it is. Okay. These are the, let me just go back. You can see that these are falling down like this, and then at the temporal point here, they arc back. There's almost this curve backwards in the very front portion right here. Okay? Same thing you heard earlier. We talked about the size for recipient sites. You're going to be making very small ones in the front. Remember, the 20 gauge generally accommodates 1 hair, 19 gauge generally accommodates 2, and 18 generally accommodates 3 hairs. So when you're doing a temporal point, the key with this is that the temporal point itself should not be with large grafts because it can look very grafty. You want to use a lot of 1 hairs here. And then I tend to use more 1 hairs toward the bottom portion if you're rebuilding some of the sideburn. Oftentimes you don't rebuild all of this, it sort of ends right here. But this is like 1 row of 1s, a few more rows of 1s in the temporal point, and then more rows of 1s in the bottom. I generally build my temple with 2s, mainly almost all 2s, and then back on the back side of that point where it starts to bend back, sometimes I use a few 3s for some strength there. And then the lateral hump, I generally like to use, this is not necessarily a textbook answer, but I like to use stronger grafts up here because remember they cascade and cover down here, so they have more oomph going down. There's more travel distance for this. And then I use 2s here. You can also just use it all in 2s, and it's a judgment issue that the graft is not too large, otherwise it can look grafty up here if you're using, if the person has really coarse hair, you may want to be using 2 hairs. Sagittal versus coronal. Remember, sagittal is the word parallel. It means that they're placed like this vis-a-vis the scalp. Coronals or perpendiculars are going this way, like this. So which one do I use? I went through a phase of doing a lot of sagittals. I went through a phase of using coronals. I'm now back to sagittals. The one fear you have with a sagittal is that it's very easy to make them too high, and they can ride up. So coronals give you a little bit more ability to make them flatter. And I'll show you both on a live demo in a moment. So I hope these photos are okay. Basically, you're seeing these are sagittals that are in the upper portion of the upper temple. It's not really rebuilt all the way, so I just rebuilt that little upper portion earlier in the slide I referred to as upper temple. The point of what I'm showing you here is a transition from the lateral hairline. You can see all these arching forward, and then there's a slight bend, and then it starts to go down this way like this, okay? And then you see here, these look like I'm going the wrong direction, but these are all coronals. In other words, they're like flat like this, so they don't ride up. You heard from Jim Harris about the idea of being careful with using the perpendiculars or coronals so that they stay flat. And this is why these are actually going down this way, but they're going perpendicular or coronally. Hope that makes sense. And this is just a little bit out of focus, but this is a lateral hump. You can start seeing it going down, okay, going down this way, progressively going all the way to almost vertical. And just some results here of some temporal points. I got a more side view. I'm sorry I don't have all the side views here. And here's just showing the sort of upper temple. And then you can sort of see this one. It's good that we outlined it beforehand so you can sort of see the temporal point a little bit more clearly. And so let's go, and we got a couple minutes to show this.